A patient today asked about Celexa or citalopram, one of your selective serotonin reuptake inhibitors or SSRIs. SSRIs work by increasing the availability of serotonin between neurons. So as serotonin moves from a neuron or a nerve cell out of that nerve cell into the space between nerve cells, your synaptic cleft, these medications prevent that serotonin from going backwards, back into the neuron that they came out of, making serotonin more available between nerve cells or more available to move to the next nerve cell. Celexa or citalopram is used, has been used for a very long time. It was actually the first SSRI to be approved in Europe, and it was started being used shortly after Prozac started being used in the United States many decades ago. It's a medication that is used for a lot of anxiety and mood disorders. So some examples of that would be major depressive disorder, other depressive disorders, generalized anxiety disorder, panic disorder, specific phobias, for example. It can also be used in OCD and in bulimia. For those conditions, when someone is treated with an SSRI, it's not uncommon for them to need higher doses than normal, higher doses than are FDA approved for depression, for example. Now with Celexa or citalopram, that's actually pretty important to know because this medication has an increased risk than for causing some changes in your heart rhythm. And so providers may actually want to do an EKG before you start the medication, or once you start the medication, or if you're at certain risk factors for developing an arrhythmia, they may want to avoid this medication. It actually used to be approved from 20 to 60 milligrams, but that approval changed from 20 to 40 milligrams when we realized that this medication has the potential for elongating someone's QTC interval or causing a abnormality in the EKG of their basically their heart rhythm. Other potential side effects of this medication, most side effects like your SSRIs, your other SSRIs are pretty transient. So when patients start the medication, I usually say take it at night because if it causes you to have a little bit of a headache, upset stomach, feel tired, feel a little bit woozy, cause your thinking to feel a little bit cloudy, then you'll sleep through those side effects, and then after a few days or a couple of weeks, your body will likely have adjusted to it. Where they won't be a problem anymore with you taking the medication because you're used to the medication, and then you can switch and take it whenever it's convenient for you, whether it's in the morning or midday or noon, just whatever time is easiest for you to remember to take the medication consistently. Additional side effects, so about 50% of men or so that take these medications have a side effect where it can affect their ability to climax or make it take longer for them to climax if they're engaged in sexual activity. And it actually is a treatment for premature ejaculation, frequently prescribed by urologists and other medical professionals. These medications can also cause sexual side effects in women as well, so making it more difficult to climax if engaged in sexual activity or dampening one's libido. Sometimes for these side effects too, I will also recommend that someone takes the medication at night after engaged in a sexual activity, because sometimes the sexual side effects, it's more so related to the last time that you took the medication, how long ago that was, as opposed to the medication really building up in your system and then causing the same side effect throughout the day. Additionally, there's a couple of additional warnings. So one is that SSRIs can increase someone's risk for bleeding and bruising. This doesn't tend to be clinically significant or very clinically significant for most patients, but if I see a patient who's older, maybe 70 years old or older, or has a bleeding disorder, or is on a blood thinner, or another condition that might make them more vulnerable to bleeding, I will want to reach out to their primary care provider and coordinate and see if they have any concerns about them being on the medication, or make sure that we're in touch if we develop concerns about the person being on the medication. And all SSRIs and antidepressants have a black box warning for suicidality. With that being said, untreated depression is a major risk factor for suicide. And so whether someone decides to go on medication or not, it's just incredibly important that if you have suicidal thoughts, that you reach out for immediate help by calling 911 and going to an emergency room or crisis center, having someone be with you, and notifying your provider right away. If you believe this video pertained to you in any way, please be sure to reach out to a mental health professional to discuss. These videos are just informative only. They're not meant to be medical advice for anyone out there.